Welcome to Value-Based Care Insights, brought to you by Lumina Health Partners, a national healthcare consulting firm focused on improving the strategic, financial, and operational performance of provider organizations. On this program, we will explore trends and share valuable insights on how health systems and medical groups can optimize their performance to meet the demands of this increasingly complex healthcare environment and shift to transform the delivery of care. Value-Based Care Insights is hosted by Daniel MArino, Managing Partner of Lumina Health Partners. Daniel has been in the industry for over 3 decades and specializes in shaping strategic initiatives for organizations in areas such as population health, clinical integration, physician alignment, information technology, and data analytics. For additional insights, visit luminahp.com and sign up for our newsletter. Dan, over to you.
Welcome to Value-Based Care Insights. I am your host, Daniel MArino. Well, Happy New Year, everyone. As we are now into 2025 and preparing for this new year, it's going to be interesting when you look at the potential changes that we're going to be faced with in 2025. Obviously, with the new administration coming in, there's going to be a lot of activity with CMS. I think we're continuing to see a lot of growth in artificial intelligence, and it's really going to impact hospitals, physician groups, and in particular, their operations. In one respect, I'm really excited about the potential and the changes that we see or are going to see. But in the next respect, it's sort of the fear of the unknown, right? What is the next few months going to look like? Well, every year at this time, we always spend a little bit of time talking about the potential trends that we anticipate seeing as a consulting firm moving into the next year. And we're very fortunate because we work with organizations all over the country. And leading up to these conversations, I often reach out and have discussions with healthcare leaders all across the country to kind of get their thoughts on, one, what's keeping them up at night, what do they focus on in the new year, and then what are the big trends or initiatives that we see emerging as we move into the next year. So to help me discuss this today, I'm really excited to have my close colleague, partner in crime at Lumina, Lucy Zielinski. Lucy, welcome.
Thank you, Dan. Happy to be here and happy 2025.
Yes, thank you. Thank you. So let's talk a little bit about this. And obviously an area that you're very close to is medical group performance, physician performance. In your consulting practice, you do quite a bit of work on helping medical groups improve, and in particular around coding HCCs and so forth. So as we think about what we're going to be faced with in 2025, what are the couple of things that you believe that are really going to impact some of these either medical groups or the provider community as we start to think about some of these new challenges?
Yeah, Dan, so it's interesting, but we have definitely seen a focus on the expansion of ambulatory services and providing patients access in communities. And with value-based care, we continue to see these delivery models continue to evolve. It's interesting, the recent statistic is about 60% of healthcare payments are tied to value and quality, according to the American Hospital Association. And value-based care has seen some great results, right? Decrease in hospital admissions, increased rates of preventative care, lower medical costs. As a matter of fact, even Medicare Advantage reported savings compared to traditional Medicare.
Yeah, and even the ACO. So, the 2023 performance ACO showed a significant improvement in the amount of savings. It continues to make some great strides in that regard. So when you think about then how medical groups need to position themselves, you're really talking about changing the care model, right? Or continuing to evolve the care model. What would be a couple of things that you feel like medical groups should focus on?
Yeah, I think one key area is definitely around care management. And that's evidenced by the 2025 Medicare fee schedule updates. If you take a
Yeah.
look at those updates, we're seeing expansion of billing, reimbursement, and coding around such things like care management services, as well as caregiver training, which is
Yeah.
really interesting.
It's really interesting. And I'll tell you, I've said for the longest time that care management is the engine behind value-based care. If you're going to do a good job, you have to be able to have a good care management program. And I share your excitement. I'm really looking forward to these new codes in 2025 in support of the caregivers, in support of transitions of care, things that haven't been appropriately coded and physician groups haven't necessarily been reimbursed for. That's going to change in 2025.
Yeah, and I mean, you're right. It's the advanced primary care management services around
Hmm.
transitions, in addition to a focus on behavioral health and mental
Yeah.
health. We even saw just recently published innovation project around behavioral health model, a new model. So definitely a focus on some of these areas that traditional medical groups have not focused on.
Let's talk for a few minutes about Medicare Advantage. I believe that as we head into 2025, Medicare Advantage is going to continue to be a focus. In the next few weeks, we are going to see the new enrollment numbers. Last year, there was about 54% of Medicare beneficiaries were enrolled in Medicare Advantage. I would not be surprised at all, Lucy, if this approaches 60%. But it's interesting because you're seeing, again, some of these smaller hospitals, some of the rural hospitals, they terminated their contract with Medicare Advantage, yet the government is still pushing it. When we think about Medicare Advantage, um, what are the things that you believe are going to continue to be a focus on?
Yeah, I think you're right. Growth is definitely going to be there, but many providers are scratching their heads and wondering, should they continue in these plans just because they're very burdened from an administrative standpoint. So I think the focus is really going to be about managing some of these claim denials, which is really interesting because in the last couple of years, Medicare Advantage, the denials have been quite
Oh,
higher than traditional Medicare. And
yeah.
many of them have focused around the prior auth denials, which really would have been avoided in traditional Medicare.
Yeah. Well, and so in 2025, there's been a lot of discussion around some legislative changes for Medicare Advantage to handle these pre-authorizations. And I'll tell you, certainly over the last month and a half, the spotlight has been on these insurance companies and the carriers, and in particular around Medicare Advantage. I really believe that if we are going to succeed in shifting Medicare beneficiaries to Medicare Advantage, if we're going to hit the goal that Medicare wants by 2030 of having Medicare beneficiaries in either an ACO or Medicare Advantage or some type of value-based performance structure, how we handle denials, how we handle pre-certifications, how we handle just taking care of patients on a timely basis, all of that has to change. Without those changes, you're going to continue to see a lot of these providers just not accepting Medicare Advantage.
Yep, I think you're right.
So let's talk a little bit about some of the financial pressures. In 2024, I think the hospital margins in general improved from prior years, but not really much, right? You're talking maybe a percent and a half. I think the last statistics that I've seen, the average hospital margin was somewhere around maybe 2.5 to 4%. And for smaller independent hospitals, they were lucky if they were able to operate at a break even. Most of them made money or covered their operations from a lot of their performance and their capital or their capital investments. But as we move into 2025, what do you see are some of the big drivers that organization providers should focus on to maybe either respond to some of these financial pressures or to react to changes within their organization to put themselves in a better financial position? Any thoughts?
Yeah, I think definitely the pharmaceutical costs, those are rising, and as you know, Dan, the baby boomers are aging. We're seeing uh, seniors. There was a recent statistic in 2023, the majority of seniors are 75 and older. And then we see a younger, sicker population. Obesity rates are high, which is a trigger, right? A risk factor. Cancer, strokes, heart failure, and so forth. So definitely, there's this focus on pharmaceutical costs.
Yeah, I agree. Pharmaceutical costs, I've spent a lot of time looking at different cost structures, particularly around Medicare Advantage and even some of the commercial contracts. As you know, we do a lot of managed care contracting on behalf of the provider groups with the plans, and oftentimes we'll dive into the total cost of care. And when you really separate that and you put them into two buckets, you look at the medical service costs and you look at the pharmaceutical costs. Um, the medical service costs, the rise has actually slowed, right? So we're seeing that rise in the medical service costs probably being somewhere around 4 to 5%, a little higher than what the CPI or the inflation rate is, but not too far off. But when you look at the pharmaceutical costs, it's somewhere around 8 to 10%. And some of these drugs have even gone up a couple 100%. I really feel like if we're going to get our arms around managing total cost of care, we have to figure out we have to come up with some solutions on how to better manage the pharmaceutical costs. And it's interesting. I don't know if it's with the drug companies or if it's with the PBMs. There's a lot of pressure on the PBMs right now, right? And as kind of the middleman, as we've heard, our soon to be or our elected President Donald Trump make mention. So, again, it's going to be interesting to see where that goes. Any thoughts?
Yeah, I agree, and even the formularies, right? Certain medications are covered, certain medications are not. So I sense that there's definitely going to be a pressure on these PBMs to manage these costs better.
If you're just tuning in, I'm Daniel MArino, and you're listening to Value-Based Care Insights. I'm here today with my colleague, Lucy Zielinski, and we are talking about the potential trends in 2025 and how it potentially will impact hospitals and medical groups. Lucy, some of the pharmaceutical costs, as we begin to think about it and how it's integrated with the PBMs, we're seeing different types of contracting opportunities there. And as you mentioned, the older population, that's where a lot of the cost structures are in place. Any thoughts come to mind as to maybe what medical groups or physician groups can do as they think about um, getting their arms around this? I mean, should they try to carve it out? Should they, and maybe try to manage it differently with the commercials? Any thoughts?
So Dan, I think some of the things that medical groups can do is to carve out those costs or out of their contracts with the commercial payers. Um, Also, another option could be to do a direct contract with these PBM pharmacies.
Yeah, I agree with you. I think, the rise in these costs make it very vulnerable for the medical groups. And, what I've often said to them is, look, you should only contract around those things that you can be responsible for. So if you can't have direct responsibility for influencing the cost of the pharmaceuticals, then you should really carve those out in some of your contracting. So we are seeing that. Or as you mentioned, and I think it's a great point, contract differently, right? So go through a PBM that's willing to work with you to begin to manage some of those costs. One of the areas that I'm watching closely is what Dr. Mehmet Oz is going to do as he starts to lead CMS. He's been fairly vocal about his stance with Medicare Advantage. He's a proponent of Medicare Advantage. He does understand that things need to change. I think potentially he's going to be the one who might push through this new legislation. And, you know, it was interesting. I was interviewed by another host not too long ago, and one of the questions that was asked of me is, who do you think is going to be a bigger influencer? Is it going to be Robert Kennedy or is it going to be Mehmet Oz? And I really feel like for providers and for the physicians, I think it's going to be Dr. Oz, to tell you the truth. It's going to be really interesting and to a certain extent, I think, fun to watch what he does because he's a very successful surgeon. He's been involved in value-based care for many, many years, and he gets it. So I'm looking forward to seeing what he's going to be able to do and where this is going to go.
Yeah, and Dan, I'll just say the obvious. He's a physician, right? He's a clinician. So he understands how the healthcare system has worked or hasn't worked. And I think he has some great insight on how to definitely improve things.
Yeah, I agree. So I'm looking forward to that as a trend and just to begin to see. I know, you know, within Lumina, we constantly watch where the market's going and try to get out in front of it. So I'll be publishing some blogs and some my thoughts going into 2025 as we start to interpret what direction we believe he's going to take and that impact on medical groups and providers. The last topic that I'm going to spend a little bit of time on is the impact of artificial intelligence within our technology platforms and within the provider groups. When you look at artificial intelligence, I sort of put it into two buckets, right? So I see AI impacting clinical outcomes and clinical performance, and then AI impacting administrative technology and operations. I believe, and this is my opinion, I don't know if folks share the same, I think we're going to see a lot more let's say quicker advancement in the administrative side of AI, supporting maybe revenue cycle management, some of these digital health tools, care management performance, and so forth. I think we're going to see quicker impact and rollouts related to that than we are in the clinical piece of it, right? I think there's a lot of research being done as to how we can use AI to maybe do some advanced diagnosis coding, but I think there's a lot of detail that we need to work out there. What are your thoughts? I know you're probably a little closer to the administrative side than the clinical side, but any thoughts come to mind?
Yes, I think on the administrative side, right? When we look at processes, AI could really support some of that. So when we're thinking about that entire revenue cycle from really the time that the patient schedules the appointment, um, check, you know, the office checking eligibility and then
Yeah.
managing some of the denials and identifying some of the risk factors, right? Those 8CCs are so important now to manage patients. And I think that's where we're going to see more AI support in the EMRs. We're seeing it right now already.
Well, I'll tell you, the HCC capture, that to me seems like a no-brainer, very natural for artificial intelligence. If you can create an algorithm that's able to look at past medical histories of visits, consulting, consult notes, if you will, lab pathology notes, and you're able to proactively identify HCCs that providers could incorporate on their visits. I mean, to me, that's gonna create so much more efficiency and just support the visit. The value, I think, is just unbelievable.
Yeah, and Dan, it's not only the visit, right? So it definitely can be integrated with all sorts of population health management protocols, right? Or even around care management with the patients. So there are some digital tools out there that provide based on that risk assessment or those HCCs or the condition of the patient. There's on-demand education. You can hold patients accountable. to certain things. I mean, there's an app for that, right? We hear that all the time, and I think we're going to see that more and more. Even insurers, we see insurers providing incentives to consumers for wellness, prevention, behavioral health. There's credits, and we're starting to see the younger population, I think, take advantage of a lot of that.
Yeah, I think it's really going to evolve healthcare quite a bit and make our care and the delivery of that care much more efficient. Um, what about for rejections and denials? Thoughts on how AI could potentially impact it, and do you see it happening within this year, or are we still a year or so out?
Yeah, that's definitely a good question. I being in the revenue cycle, denials, especially some of the complicated ones, take a lot of research and appeal and time research. And I think that's where AI can definitely support some of these denials is come quicker to a solution and update the claim, correct the claim, and then resubmit so it is accurate and then reimbursed.
Yeah, I agree with you. I think it does have an impact. And the interesting part about AI related to rejection and denial management is there's a direct return on investment that can be tracked. So if you go
Huge.
into this and you have an idea that, or that your denial rate is, let's say, even 5 or 7%, if you're able to incorporate new technology, you should be able to see a quick return in your revenue by the decrease of those denials. And you know, I I agree. If we can do more with less and create these algorithms that allow us to either properly code the first time around or manage these denials once they do become denied, then I think it'll make it easier for all of us.
Yeah, Dan, I would love to see that FTE count in that billing office and with revenue cycle decrease and the FTE count with the care management, taking care of patients and managing patients' care, helping them navigate the system, especially those with chronic conditions, increase. So
Yeah.
kind of a shift of resources over to the clinical side from the administrative side.
Yeah, I agree. Well, Lucy, one thing I do want to make mention, and I think on behalf of our audience, it might be interesting just to spend a couple of minutes. Um, the last couple conversations that I've had with some of the leaders, one of them actually turned the table on me and said, "What's Lumina doing to position itself for some of these trends in 2025?" And I thought it was a great question. Most of the time, I'm the one asking the questions,
Mhm.
right? So it was a great question. Really got me thinking that, well, maybe I should spend a couple of minutes talking about how we are evolving Lumina Health Partners into 2025 to continue to support hospitals, medical groups, and the provider community. So we're going to be focusing on three things, right? And I think, those three things are: one, enterprise strategy, and included in that is value-based strategy. So how can organizations position themselves for continued success in 2025 and beyond with some of their value-based contracts and their structures? The second area is medical group performance. And I know this is an area that's, you're very close to, everything from revenue cycle to capturing HCCs and coding. We're doing a lot of education around HCCs, code capture, as well as clinical documentation improvement. That's a big area. And then, of course, payer contracting. We do a lot of payer contracting support. And then the third area, which we're really excited about, is the expansion of supporting single specialty service lines. As we move into value-based care and particularly position organizations for risk, we have to do a better job of integrating specialists around the cost models, but it also has a fee for service component to it as well. So one of the areas that we are focused on is operational improvement of the operating rooms, integrating anesthesia, because not only does it help with value-based performance, there's a direct ROI associated with it. So I would suggest to any of our listeners, if you're interested in finding a little bit more, everything from just blogs and articles or just information you could share with your teams, or if you just want to have a conversation, please feel free to reach out to either me or Lucy. My email, as you know, is dmarino@lumina luminahp.com, or please visit luminahp.com/insights for more information. Lucy, any final comments or thoughts?
I think we're going to see, Dan, like we talked about today, definitely a shift in the healthcare industry. It's going to be a big year, I think, in 2025, with a more focus on quality and just really taking better care of our patients. And I'm really excited to see that come to fruition.
Yeah, I share your excitement. I'm looking forward to seeing how we can put some of these things in place, respond to some of the changes in healthcare, and really see some of our providers and our provider community get back to really, enjoying the care and providing good care to our patients. I'm looking forward to that as well. Well, I want to thank all of our listeners for tuning in. A very, very happy and prosperous 2025 as you enter into this new year. Until the next insight, I am Daniel MArino, bringing you 30 minutes of value to your day. Take care.
Are you at a crossroad with value-based care? Do you need to chart a future strategy or improve your organizational performance? Visit us at luminahp.com to learn more about our consulting services and leadership development programs. Also, you can sign up for our newsletter on our website and follow us on Twitter and LinkedIn. For more information about value-based care insights, visit the programs page on healthcareradionow.com or luminahp.com. Join the conversation using our hashtag VBC Insights. We are Lumina Health Partners. Thank you for joining us today. Until the next value-based care insight, stay well.